No, I'll go right now. And that way, if anybody wants to chime in and throw stuff at me, they can. I got fired up before when I first got here, so you guys, so a lot of you missed it. Anyways, I'm going to give you some great positive news today that you have not heard. You've heard doom and gloom. But you know that Shiawassee County has not had a case of COVID in 13 days. We only have, what, 12 cases left out of 67,000, nobody's sick. We had 26 people die. Out of that, 19 were in homes, 7 were in general population, 1 was under 60, and the good news on that, nobody died of COVID. But people did die during that time of flu. But no one died exactly of COVID, underlying cases, causes. On Friday, the Supreme Court of Michigan ruled in a barbershop case that this state will operate under the rules of law and not hysteria. Our governor is operating this state under hysteria. Supreme Court stated it. The Supreme Court also stated that they didn't want to see this case come back. So 3 hours earlier than that, the governor hurried up and opened up all the barbershops and such, because otherwise this would have gone back to the Supreme Court and they would have had to rule.
Are the barbershops open now?
Well, if you want to.
Oh, I didn't know. Not legally for her though, right?
Not by her order, but by the Michigan Supreme Court. Hers were orders, not laws. Okay, let's take a look at this COVID-19 for Shiawassee County. It never happened. It didn't even become a ripple. We had here in March, you were all told that on May 15th we were going to have 600 people sitting in a hospital, laying in a hospital, and hundreds dead. May 15th, I think we had 13 people in the hospital, if I remember right. 13, maybe 14. We have 0 today. Yes, I already told you 26 died, but not of COVID. I believe that it is time to put this to rest. We need to bring our county back into knowing it's safe to live here. 12 cases out of 67,000 is nothing. But we see people wandering around with masks on, and if you read the CDC reports and such, people are going to get sick from wearing masks. Our bodies are not designed to wear masks. Our bodies are designed to expel the stuff, get it out of us, and get done with it. We're taking that stuff, we're putting it in the mask, taking it back in. Putting it in the mask, taking it back in. They said it's not good. It's more people are going to get sick. So I got this annual report. It's great. We've got some great things to be happy for in Shiawassee County, and I think the happiest is we need to have someone stand up and say to the county live on video, it is safe to live. You're not going to get sick. You're not going to die. You're not going to die. Nobody has. So that's about what I've got to say. I've been the only news source that I know of that has been from day one putting out, we aren't getting hit, we're not getting hit, we're not getting hit, and all the others are putting out, oh, you know, we still have sick people. No, we don't have any sick people. We got 12 people with the virus in them. That's it. And who knows, maybe a lot more people, but nobody's sick. But we had people that died of the flu. I know a man. Also, he went to the hospital. He had the flu. They did a COVID test. He didn't have COVID. They sent him home with the flu. And he died at home of the flu. We don't keep track of adults that die of the flu in Shiawassee County. I don't know why we don't. We do have children. But I don't know why we don't keep track of adults. So all I'm asking is, it's a political hysteria. Our Supreme Court ruled it Friday. And we really need to let people know, get back out there and go to life, go living. People are scared. scared to death. Thank you.
Thanks, Tom. Agenda item 4, authorized $2,049.17 for 41.5 hours overtime wages for emergency manager Jeff Weiss as a result of the COVID pandemic and submitted to FEMA, submitted for FEMA assistance.
So moved.
Moved, do I have support?
I'll support it.
Okay, so discussion. I know personally, especially the first couple of weeks, Jeff put in a lot of time down there in the EOC. Larry, you want anything to add to that, or Jeff, or just?
I'll just say, he was awesome to work with, absolutely amazing. I don't think I could have done a lot of stuff that I've done without him. We were together as co-incident commanders. I know that he's part-time and temporarily went to full-time. You're in strike, so if that means anything.
Also, too, if you read the notes, this is put in the request for reimbursement. We're probably getting reimbursed for it, but we have to pay it first. So, most likely we will get all one. He's one of those. You got it.
Yeah, I can speak to that, Mr. Commissioner. Yes, we will be putting in for FEMA public assistance. Forced account labor is one of the categories that they will reimburse you for. Now it's a request only. It's not 100%, but
Hey, if they give us 80%.
yeah, we will be putting in for every dime we spend, every penny we spend. Whether they issue or not is up to FEMA. But yes, this is certainly within the category of being eligible. So I thank you. Yes, sir.
Who puts that together? You?
I do, yes, correct.
You do?
Yes. It is done through the County Emergency Management Office.
Is this submitted already, or you gotta wait yet?
No, you have to compile all the data first. There's no firm end date that it has to be in at this time. So we're just still compiling all the information along with that after action report for the incident.
Thanks.
So along with everything else and severe weather we got going for us tonight and tomorrow.
Do we have anything for Gabby? Is her hours being submitted to, or?
Yes, her hours will be submitted. She has now went back to 24 hours a week. Her hours and my hours over 24 hours will be submitted because that's outside of regular scope of work, outside of regular 24 hours. So yes, during the entire incident, the 16 hours additional for Mr. Reynolds and myself will be submitted for reimbursement as well. Any other questions?
Questions, Jeff?
Thank you.
Okay, all in favor of moving this to board for Wednesday, say aye. Aye. Opposed, say aye. Motion passes. Next agenda item, the second call of the public.
Yes, I gotta finish up. I just want to say thank you. The health department's done a great job. I appreciate them greatly. So by no means do I want anyone to get the idea that I didn't think they did a great job. They've done a wonderful job. And I'm just asking one of you people to stand up and say to the public, thank you.
I know we don't have this on the agenda, but Jeff, can you just give us, I know you were really involved, just kind of talk briefly about Saturday, what everyone's role was and kind of how it all went down and
It was.
cooperation from everybody.
Amidst the public assistance after action report, the planned protest, peaceful protest in Owasso took place. Many hours of planning went into our possible response to ensure that it was peaceful. Virtually every law enforcement agency in the county was there being represented. So it was however, it was a very peaceful protest. Everything went great. And I think it was a good representation of peaceful protest in Owasso. So yes, many hours went into the planning for that incident. I'm sorry, sir.
Free training exercise.
It was very good.
How many was there?
Approximately 175 people. There was a small contingent of protesters, and large contingent of protesters. And we say protesters, of course, meaning they could be supporters or however you want to look at it. But there were a handful of anti-protesters across the street. They stayed separated. Everything was it was very well. Our planning paid off, and it turned out very good. So many hours went into the meetings with the Wausau Police Chief, the Sheriff, and myself, and Lieutenant Sheriff from Wausau PD. However, we were very happy that none of our services were needed, other than traffic control to allow for safe passage.
Any other questions for Gus?
Thank you.
Anyone else has? Meeting adjourned.
Please stand and say the pledge. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, first call to the public. Is there someone over there?
Mr. Reed from Bedford.
Okay, are you just letting me know you're here,
No, I was just putting my hat back on.
or? Oh, okay, I thought you were my call to the public. All right, seeing none, we'll go right into the agenda. The first item is to authorize the contract renewal with the SRESD for IT services for the Health Department in the amount of $75,000 from July 1st, 2020 to June 30th, 2021, and authorize the Health Director to execute the necessary documents.
Support.
All right. Well, you made the motion right here. Okay.
I'll support.
Motion and support from Commissioner Marks. Any discussion?
Yeah, this is renewal from last year, exact same contract.
Yeah, one clarification on there is a 2-year contract, and that rate is frozen for 2 years, which is the same rate it's been for the last 3. So that was a positive. Exemplary service. We're very happy with the RASD and what they do for IT.
Thank you.
Yeah, they did a good job.
All right, all those in favor signify by saying aye. Aye. All those opposed, the same. Motion moves to the mark. Item B, authorize the health director to hire a summer public health intern at $11 an hour and not to exceed the grant funding.
Move.
All right, I have a motion and a support discussion.
Can you get somebody to that amount of money?
Yeah, we can.
Oh,
This is the public health intern that we've hired for the last 3 summers. The Cook Foundation funds it for us. Our required obligation to pay is $350 in health department funds, and that's a pretty good deal to get a contact trace. So this person's going to do contact tracing for us this summer. U of M, public health student, you know, I like to hear those Spartans, but you know, we're very thankful for the Cook Foundation to support this, and it's worked out well for us the last 3 years. So we're looking forward to having them come on board.
All right, thank you. Anything else? All right, all those in favor of this signify by saying aye. Aye. All those opposed? Motion moves to tomorrow. Item C, authorize the Veterans Affairs Director to hire a part-time driver not to exceed a total allocation of $15,350.40 and authorize the same to be transferred from 298-684-803000 to 298-684-705000. Do I have a motion?
I'll make the motion.
Thank you. I'll support that motion. Mike, do you want to speak to this?
I'll just provide some context and stuff for everyone. As everyone knows, we've contracted before with Transportation Solutions to transport veterans that we couldn't handle or overload, or buses or vans going to 3 different CBOCs or VA centers at the same time. So we ended up getting the county van. Through COVID and the ongoings of starting everything back up, what we've learned is, due to the fact that our volunteer drivers are all vetted and approved, if you will, through the DAV, they technically control how they're utilized, when they can drive, when they can't drive. So that means that if, for whatever reason, driver X can't drive the DAV van for whatever reason, they technically can't drive our county van, and that does put some issue on liability should something happen during the transportation of a veteran in the county van when the DAV has said this driver can't drive for reason X. We didn't know about it, so in thinking, there was some money that was reallocated for this year's budget, $25,000 for a lease. That's not happening. So I'm just moving those funds, the $15,350.40 from those funds to augment our department with a part-time driver. Monday, Wednesday, Friday is going to be the schedule for that driver, specifically for the county van. In that way, it will keep our veterans serviced. We'll still be utilizing the county van. As you'll know, we hit that mileage marker where we could actually request a second county or a second DAV van, but we've ended up buying that county van because we have that many people and we're making those different trips for that. So in hiring this person, we'll keep everything going. It's not going to interfere with our budget at all. It won't be coming out of any of the county general fund. We would be adding an individual to the roles of a county employee. As part-time though, it wouldn't be any health care benefits, wouldn't be any retirement, and they would not exceed, I believe it's 29 hours or 31 hours is the max for part-time, and we would monitor that and keep them under that. So, pending your questions. Yes, sir.
How far away do you usually go?
We've gone as far as Battle Creek, and I know last year we once made all the way up to Traverse City. That's rare, but normally is Detroit, Saginaw, and Ann Arbor is where we transport. And we have done multiples. We've had a veteran that had a VBA or a hearing there at the federal building the same day that we had one veteran at Ann Arbor and one veteran at Saginaw. And we had to use Transportation Solutions for one of those passengers.
Thanks.
Mike, I had a question. I know that the volunteer drivers, that has been a challenge for you to keep volunteer drivers. How is that going?
We're still looking for numbers right now. We went from 9 to 4. We had one essentially retire due to some health reasons. He decided to step back. We've got 2 on vacation, and I've got 1 that the DAV is saying that we can't utilize due to hearing, and I'm trying to work something outside the box to get him to where he'll meet that hearing requirement. But again, he drives his car to and from wherever he's going for himself, which there's no rules or regulations why he could drive the county van. And I've talked with both legal and also our insurance folks, and as long as the county doesn't have a policy as like DAV for a hearing requirement, there would be no issue with him driving the county van. The problem comes in since he's been vetted by the DAV and says that you can't drive this van due to hearing, because they did that vetting process, that then would carry over to any other veteran servicing vehicle that that driver goes into, which now our van becomes part of that. So,
Are you gonna be able to meet the transportation needs with just those 4 volunteers that you now have?
we are, they're stepping up and putting up more hours. We're gonna, once, I guess, things get to a little more normal, we're gonna have a hiring event for volunteer drivers. I believe Paula has got 2 applications in the works now that COVID kind of stopped everything. They were going through the process in Saginaw. That switch will get turned back on. I can't tell you right now where they are in that hiring process. I'd have to get back to you with that information. But there are 2 more in the queue, so that would move us back up to 6. But we are hurting for drivers, so I'm not gonna fight it here.
Do you have to be a veteran?
No, you do not. We would like it just because of that camaraderie rapport. Should there be an issue or questions along the way, they're a little more familiar with that veteran path, but you don't have to be, no.
Do we have that like on our website, or is there any way we can help, you know, let the public know we're looking for those volunteers, or?
I've got several different, we can on the website, I don't believe we have, but I can definitely make that happen. I know we've gone with Argus Press, Independent, Caroline's Flyer, I think we took an ad out, a couple of the high schools. Last year for their sports programs, we put that in a couple of their flyers based upon the number of folks that they were reaching out to. So we've done quite a bit. The next step, the committee wants me to do a marketing campaign with a local radio station. Lloyd, I think it is, don't get me lying here. But whoever it is at the local radio station doing a weekly blurb or something, message to the community. One that we're open back up for business, but the other is a plug for volunteer drivers.
Okay. All right, thank you. Anybody have anything else?
Just want to make sure I get all my facts straight, because my gut instinct is to deny this request, because we told our county clerk yesterday no new hiring. But I want to make sure that I have all my facts before we go ahead and vote. So I understand completely that we have money put aside for a lease that will be used. Leases eventually are paid off and expire. Is this money coming out of a fund that's levied in a millage for veterans only?
No, this is coming out of our operational fund. It is a millage though, but it is not specifically for veterans with that wartime or peacetime clause. No.
Okay, I understand that. I'm just trying to square with the fact that we tabled yesterday, you know, we were all pretty in agreement that now's not the time for hiring new people, right? And then to sit here and then hire someone. I understand that this is a bit of a different situation, right? That's why I want to ask these questions. For instance, no economic impact doesn't come out of the general fund. Understood. When did we vote? Does anyone just remember if it was $25,000?
I think that was just a budgetary move. They had these properties, and they wanted to have money allocated so that they could get into a lease agreement.
Correct. That was during our October budget review, and then the November, I think, approval, if I'm not mistaken.
So that's not vehicles, it's actually a lease for a new.
That was what we were going to use for the space to get them out of the third floor.
That's probably on the back burner right now, I presume, with the COVID and everything. Okay. This was tough, for me, because I understand the need. This is absolutely a fair request to come to us and say it's no money, but I think in order for me to stay consistent with what we've talked about, if I say no hires, then to me it's no hires. I'm not going to make, I personally am not going to make exceptions, even though this one doesn't seem to give the budget a hit. It does seem to give the county service a good one. But at the end of the day, I just can't, I don't know what kind of message that sends to the rest of the county when we make a picture shoes.
Yeah, and truth be told, and I don't know if this is a hard one, sure or not, but as you know, I'm pretty transparent. So, it is a hard time to come and ask this request. One, we've got furloughs going on in the county, and we're asking folks that could potentially impact their pocketbooks, their budget. And we all know perception is reality. And so if the community's perception is, hey, how on the right hand are they saying, no, and they're closing, and this hand they're saying, oh yeah, we're going to hire this person. I understand your stance completely, and this might be the wrong time. So instead of maybe a no vote, table it until on down the road, might be a better option, and I completely go that way. So
I think that's what would be my recommendation, as long as this is when we revisit clerks.
And I'm not necessarily opposed to it. My only concern is that I don't want to send a message or have it happen that we have a veteran in need of the medical services and no way to get there.
And to answer that question, we would just have to use transportation solutions, which means we're paying a little more out of pocket and giving this to somebody else and using our own resources and funds. We've done it in the past for 2 years. We've just been slowly weeding away from that with the purchase of the county van, and now with the hiring of that person, we would even take that next step, however it is. If we have to take that next step in August, then that's, I understand that.
So the county van will sit there and we pay somebody else?
Not necessarily, we would still use it, but with drivers that can still, again, drive, say, from the Saginaw VA, whereas we won't just have someone that's solely designated county employee, county vehicle on these days to drive. So the drivers can still be managed by the Saginaw VA and when and where they can drive. And we'll just have to adjust schedules. So a little more work on our end, but that's what we're aiming to do, so it's okay.
If you guys do choose to table it until July, and then that way you pick up in July, and they would be able to begin immediately in August. Because it takes time for posting requirements, etc. If that's the direction you choose to go.
Thank you.
That's my opinion, that would be my favorite relationship. Mr. Three. Again, I think it's I support the project.
I agree.
It's always common sense, this is another common sense, it just, one message to be consistent.
Timing is probably a little off, and when I wrote this up, I didn't even think about it until early last week or late last week. Someone's like, hey, don't forget they're kind of in the hiring freeze, and I was like, oh, crap. So, horse is out of the gate already, so it was sent to you guys.
Okay, so we have a motion on the floor.
Thank you.
Thank you. Commissioner Holzhausen and I supported that. All those in favor signify by saying aye. Aye. All those opposed?
Aye.
Motion fails. Our next item of business is to adopt.
They make a motion that they make it,
I certainly would second a motion.
I mean, do we need to bring it back to council? Is that, do we really need to, in the motion failed 2-1? I just bring it back.
I would just rescind your vote and just move to table it to July.
Okay, Gary, so you want to amend your motion to instead of remand?
It's good, table it until July.
All right, all those in favor of tabling it, signify by saying aye. All those opposed? Aye. Motion to table carries. All right, we will adopt the 2019 Health Department's annual report as presented.
Just briefly, is this something we got to vote on, or was it just here?
No, you guys usually just
Here.
accept it, yeah.
Motion to accept and place on file.
Okay, I'll make a motion to accept it, please have file.
So, you know, a lot of stuff has been going on in 2020, obviously related to COVID, and that'll be well covered in the 2020 report, but we wanted to highlight the positive things that happened in 2019. The two main points that I want to direct your attention to are, number one, the building of the new facility, the addition to the Capitan Center, which has just been wonderful for the county and for the residents and clients that use the services over there, help fulfill space needs. And that was from your leadership. And I want to recognize our commissioners that are on the health board, which is Commissioner Marks and Commissioner Witt, for helping get that process delivered, which was just about 1 year ago since we dedicated that building. So I know things have changed in a year with the world. So I wanted to direct your attention to that. And then the second thing is the accreditation that we've had over the last 6 years, 2-3-year cycles. We've achieved a perfect score for the health department, and that says something about the team that's over there. They're unbelievable, and Commissioner Marks know because they're on the health board, and they give the reports monthly. Throughout this whole COVID thing, you know, they've been awesome. And so we're very fortunate to have what we have in place, and so I just wanted to point out those two highlights. There's other highlights in it. It's a nice report, and I can get an electronic copy for anyone that wants it. To get one for the clerk. Hope you take time to look through it. If you have any questions, burn around, or oh man,
Everybody else gets these nice views.
no, we got one last week.
Yeah,
I had to get one to Tom, so.
I got these nice colorful stack of papers, not even in the right order.
We'll get you another color copy. So with that, you know, if there's any questions or anything, any highlights that you want to ask about, that's happy to have you come over and check out if anybody hasn't been in the new facility. I know many of you were there for the dedication last year. So I thank you for your time.
I like the color. Great.
Yeah, I really enjoyed it. I like the color one.
Yes, I am.
Thanks, appreciate it.
Thank you. All right, so we have a motion on the floor to adopt the health director's annual report. All those in favor signify by saying aye. Aye. All those opposed? All right, second call to the public. Tom?
Something caught my ear, and when I heard contact tracing, that caught my ear, like, for what? Give you an idea, we were told that the barber in Wausau that had 1,500 people come to a shop from all over the state, they did contact tracing because they wanted to find somebody sick. And in 4 weeks, they couldn't find anybody that got sick. They couldn't find anybody that caught the virus, or brought the virus in, or transferred it anywhere. So why are we paying money? And to me, this is a violation, I think, of people's rights. What right do we have to follow somebody around? What right did the government have to follow somebody from Dearborn who came and got a haircut? Or me that came and got a haircut? Who has that right? They say we don't take down names. Nonsense! They have to have the names so they can contact people. I believe it's a total violation of our rights, and especially since we don't have COVID-19 here except for a political hysteria, according to our government, according to our Supreme Court. So why are we going to violate all these people's rights and chase them around? I don't believe it's fair. I don't think it should be legal. Now, if we had cases here, we don't have any. So who are they going to chase? Is it every time I leave my house, they're going to track me? Because I'm with a lot of people, and I got, he might catch COVID someplace. It's nobody's right to know where I go. So I'm just asking you, please, it should be illegal. Thank you.
Thanks, Tom. All right, I think that concludes our call to the public. Unless there's anything else, this meeting is adjourned. Thank you.
I have to go.